the next one. Okay, so nystagmus. Previously, we said nystagmus is the rapid eye movements in either of the directions. Okay, so this is a short video which shows nystagmus. I think because of the internet connectivity, I don't feel you are getting exactly the movement. Okay, so I will repeat. If let's see if you can able to see. Okay, this is your horizontal. Okay, so the next one is the torsional one. Okay, the torsional one means there is a rotation of the eyeball. Okay, I feel that this is not clear to many because of the slow internet connection. This fast eye movement is not perceived properly. Okay, as I told you, and this is how it will be recorded. In the ABR, what you see is the waveform. You will have your first peak, you have your second peak, and you have till your fifth peak. Okay. So how do we know it is a peak? You will have your uh, positive peaks, okay, which is greater than the baseline. Okay, that's how we will know it is waveform. Here, what we see is only these kinds of zigzag lines. When we see a report, ENG report or VNG report, we are going to see only zigzag lines. Okay, and we have some other graphs which has dots, data points. Okay, based on this only we are going to analyze what kind of a nystagmus is present. Okay, so we have this graph, this nystagmus graph. In this, any upward movement is considered movement of uh, eye towards the right side. Okay, so let's consider you are standing at this point. Okay, you're standing at this point and you're looking straight here. Okay, this is kind of a zero line. Okay, so you have your zero line. Okay, from here to here you have your zero line straight, and then you're standing and looking at this point. If your eye is changing towards the right side, it's going up. Okay, and if you're looking at the left side, you're looking at this point. Okay, I mean this is opposite. Let's consider you're standing this way. Then it will be easy for you to understand. You're standing here and looking at this point. Okay, if you're turning towards the right side, you're looking here. If you're looking at this point, the degree of movement of the eye, right and left. Okay, so what happens when the things go up, it is right, and if it goes down, it is left. And you have other way of understanding. In the this is horizontal, right? So in the vertical, if it's going up, it means the eye went up, and if it's down, which means the eye came down. Okay, so as I told you, it has two components, slow and fast component. Okay, slow component is because of your vestibulo-ocular reflex, and the fast component because of your saccadic response. Okay, if we have to name a nystagmus, we will name it as right beating or left beating nystagmus. The beating is based on which side it is having a fast component. Okay, let's see in this example. Okay, in this example, the slow. response is towards your right side. You see that? Okay, it's slowly going up. Okay, and then what happens? It suddenly comes towards the left side. Okay, the eye movement, okay, slowly changes to the right side, and suddenly the eye comes to the left side from the right side. So the fast component is actually towards the left side. So we will call this as left beating nystagmus. Is it clear? Fine. So what actually will be measuring? What is the difference here? You see any difference? Look at this diagram. Okay. The fast component is towards the left side. Here, the fast component is toward the right side. Okay. So this is a right beating nystagmus. You understand? Look at this. The slow component is towards the up, which means right side. And the fast component is towards the down, which means left side. Look at here. The slow component is towards the left, and the fast component is towards the right. Left, right, left, right, left, right. So this is your what beating nystagmus? Left or right? The fast component is towards the right side. So this is called as right beating nystagmus. Okay. So then what we look at is when there is a nystagmus, what do we measure? The most important thing we measure is not the fast component. Okay. The fast component is used only to name the beating nystagmus, right beating or left beating nystagmus, and that's it. The real measure which we take from the nystagmus is this slow component. Okay. SCV, which means slow component of eye velocity. The eye is moving, right? So we need to know at what how fast it is moving. Okay. So how do we measure it? When there is a slow component, we are going to have an AB diagram, right? AB line. So in the AB line, this AB line will be there in the recording also. Okay. So we have to place this AB on exactly on the slow phase. Okay, if it is right beating nystagmus, we will change it the position. I mean, this is correct. If it's a left beating nystagmus, we will change the position because it will not be falling, it will be rising. Okay, now A is top, B is down. When it's a left beating nystagmus, the A will be down, B will be top, right? You see the difference? Okay, so then what happens? Again, your Pythagoras theorem. Okay, so once your Pythagoras theorem comes into picture, you will have your x, and then the vertical thing is y, hypotenuse. Then you have your formula y by x. Then we get the value as 4 degrees per second, which means velocity means what? How much fast and the car is moving in a given second. Okay, the movement per second. That's your velocity. Now here the eye is not running. It's just moving in degrees. Okay, it is just looking from degrees. When you look straight, it is 0 degree. Okay, when you're looking exactly left or exactly right, complete right left, it is 90 degree. Okay, so the nystagmus is measured based on the degrees. How much does the eye deviate? How far does it go? Okay, from center, how far does it go, right or left? Is your it is your SCV. So why this is important? Because the fast component is your correction thing. The more you make mistake, the more you have your correction. Okay, so we don't measure your correction, we measure the mistake. Okay, so when does the mistake happen? When there is more problem in the vestibular system, you will have more mistake. When you have less, you will have less mistake. Okay. So when the affected side is having little bit of a problem, then the eye, then it will send a message that it has moved a little bit. Okay. So what happens when the, depending on the movement of the head, if you're turning only a little bit, then the eye will go towards the opposite direction little bit. If you're turning completely right, then the eye will go completely this side, so that it is trying to maintain in the midline. And then the saccadic movement will try bring it back to the left side, because I need to see something on the left. Okay, saccadic movement is actually a voluntary movement. I mean, we need to see something. It is because of saccade. Okay, one example is that imagine you're sitting, and suddenly you see a crow is making sound, and the eye suddenly checks the crow from the direction of sound. This is saccade. Okay, without turning head, if you're just trying to fix it, that is saccade. Let's imagine with just eyeball you cannot see the crow. You have to turn your head. When you try to turn your head, without asking you, your eye will go in the opposite direction. Okay, this is reflex, VOR. But I want to see something on my left. Then the saccade, what will it do? It will bring back the eye to the image. Okay, so depending on the movement of the head, the eyeball will go on the opposite side. If the head is moving little bit, it will go little bit on the left side. If it is going too much, if it will be on, it will be moving very much. Okay, so if there is a mismatch, and depending on the mismatch, the nystagmus will happen. If there is so much of a nystagmus, so much of a mismatch, it means the head is turning. Even if it is not turning, the affected side is sending signal. The brain is understanding that there is a large movement. If there is a large movement, the nystagmus will be very big. If it's a small movement, the nystagmus will be very slow. That's why where SCV is very important. The slow component of the eye velocity is very important to know the degree of pathology. How severe is the pathology? This is very important. Okay. Any doubt in this? Okay, there's a doubt, sir. You said affected side sends signal, which means it sends a defective signal. We can take it as like that. See, it is not that when it is affected, it completely, no, it's like, it's not like all or none phenomenon. Okay, if there is a problem, the response may not be equal to the excitatory pattern. Okay, which means previously in the last class we saw an example that one side doesn't send signal at all, the other side is sending spontaneous rate. Okay, because of this the brain understands that there is a movement, because the spontaneous rate considered as excitatory response, because the difference between no response and spontaneous rate is looks like it is turning towards the normal side. But not necessarily every time there is the affected side should not, should send no response at all. It may send little bit of response. Okay, if affected side is not going to send proper response, let's consider like this. What in case if there is a spontaneous uh, firing in one side, and on the other side the responses have come very low, which means it is firing less than the spontaneous rate. It is not firing normally without stopping firing, but it is firing in a very slow way. This will represent inhibitory response. Okay, when one side is sending inhibitory response, it means that the spontaneous rate is more and the inhibitory response which is sending by the affected side is less. Okay, when they see the mismatch, then the brain understand that the normal side is sending excitatory response, which means the head has turned towards the normal side. Okay, so when I said the affected side sends signal, it sends a defective signal. It is not sending a normal signal. Okay, it may either send a defective signal, or like we previously saw, it doesn't send signal at all. Okay, both are problematic. Is it clear?